I'm Stuart MacLeod. I'm standing here primarily, I think, because I'm the president for another 48 hours of the Canadian Society for Clinical Pharmacology, and I also have a long-standing connection with Dr. Gideon Koren, who's sitting here on my right, and a long connection with the Motherisk program that's prominently displayed over his head. The topic this morning is an extraordinarily important one. I think we're going to look at the establishment of new benchmarks for drug evaluation during pregnancy, a topic which has really shown increasing prominence over the last 20 years. Is that the right number? Since the foundation of Motherisk, which goes back to the Hospital for Sick Children in the mid-1980s when Dr. Koren arrived in Toronto. I'll just, by way of very brief introductory remarks, just say that I think this topic illustrates very well what's going on in the whole research world of clinical pharmacology. We're moving from a situation in which we have concentrated and we've sorry, I'm losing my way. We're trying to build on the strengths of clinical pharmacology to marry and integrate the basic research that comes from pharmacology and genetics, along with our capacity for clinical research, applied research, and population-based research, pharmacoepidemiology, and to somehow integrate those two spheres of research activity to bring about better care for patients. And a very important underscoring of this activity is our capacity for knowledge translation and for knowledge transfer. And I think you'll hear as the morning goes on how important all of those activities are to success in bringing about better drug therapy for pregnant women. I come as well from the Provincial Health Services Authority in British Columbia, and I just wanted to plug that organization briefly since I'm here halfway across the country. PHSA is an interesting organization that has responsibility in British Columbia for child health, for women's health, for mental health and addictions, and for a number of other things that you see there. But the important point, to my view at least, is that it's an integrating force again, that it brings together expertise in children's issues, women's issues, mental health issues, and these things often come together around pregnancy. I think it's enormously important that we're beginning to ask the key questions about drugs and pregnancy, and I think we owe a lot to Giddy for having led that discussion. I quite like this quote from Goethe. Comes from 1842, I believe. We know with certainty only when we know little. With knowledge, doubt increases. It's so important that we begin to ask the questions about how best to use drugs in pregnancy. It's no longer enough to just do this on an empirical basis. So I think the fact that we have research organizations like Motherisk that can help us with this is enormously important. And there's Goethe himself. He's reputed to have said on his deathbed, "Mehr Licht," more light. I think he just wanted somebody to open the window, probably, but let's take it instead as a cry for more enlightenment in the field of drug therapy and pregnancy. And with that, I think I'll turn it over to the poster boy of the day. Those of you who haven't seen yet, Dr. Koren is on the front page of the Globe and Mail, having cleverly arranged not to pre-publicize his talk this morning, but just to show that he's a multiple threat. This is about drugs and lactation and genomically determined adverse drug reactions, but it's clearly relevant to other issues that we're talking about this morning. So I'm looking forward very much to this outstanding symposium, and I'll just turn it over to Giddy now to lead us through the day. Thanks. Thank you, Stuart. On behalf of the Motherisk program at the Hospital for Sick Children, which is a block north from here for those who come from outside Toronto, I want to greet you and thank you for coming. What we try to do with our colleagues coast to coast and United States of America is really to engage today in a very keen and hopefully in-depth discussion of some of the issues and challenges related to drug therapy in pregnancy. And the program is reflecting this. The issues are not simple, and any attempt to simplify them will not work well. But I'm so glad that so many of you chose to spend the morning here with us as part of the Therapeutic Congress. And I'm sure that this will carry on because everything you hear this morning will be published in the Canadian Journal of Clinical Pharmacology as a symposium. So we do put it into the public domain as a document of what we believe for 206 should be done for women and is not done. I'm not adding too much more because I know this will come up in the talks by different people. But we are similarly glad that coming together to make this meeting going on is the Society of Clinical Pharmacology, Canadian Society, which Stuart is the president. But with us is Dr. Donald Davis, coming from Medicine Hat in Alberta, but Dr. Davis is the incoming president of the Canadian Society of Obstetrics Gynecology of Canada. He is important because not just as the coming president, he is representing a community-based obstetrician where so much of these issues are coming to the forefront. And Dr. Davis, before becoming the president of SOGC, has been very, very active and effective in the Alberta region of the SOGC. So please, Donald.
Thank you very much. The Society of Obstetricians and Gynecologists is pleased to have been asked to participate in this conference. We're here to learn. We're here to understand how we can provide for our patients. We feel this is a tremendously important group in society. And in fact, they are the future of our country and our nation. So that we would make a plea for cooperation, for working together, for understanding, so that we can, as a society and as a group of physicians, treat our patients with evidence-based knowledge in order to ensure that they get the best care that they possibly can. So I just would like to thank the organizers on behalf of the SOGC and indicate to them our willingness to help and participate in any way that we can. Thank you.
Thank you.